Imagine you wake up on January 1st. You haven't changed anything. Same job, same plan, same doctor. But your health insurance bill has doubled. This is what 22 million Americans experience at the start of 2026. You're at your kitchen table. Maybe you're a freelance designer. Maybe you run a small business. Maybe you're between jobs. You pay for your own insurance. You always have. And this month, something is very different. The number on the screen. You read it twice. Your premium for 2026 is not what you expected. It's not even close. A tax credit you didn't know you depended on just disappeared, and nobody warned you. According to KFF, the average premium for people who received enhanced subsidies went from $888 to $1,904 in 2026, a 114% increase overnight. To understand what just happened, you need to go back to 2021. The pandemic had wrecked the economy, millions had lost jobs, and with them, employer health insurance. Congress needed to act. The American Rescue Plan created enhanced premium tax credits. For the first time, people above 400% of the poverty line could get help, and everyone else got much more. It worked. Enrollment surged to record highs. In 2022, the Inflation Reduction Act extended those enhanced credits through 2025. For 4 years, 22 million Americans built their financial lives around lower premiums. They made decisions based on those numbers. Then, December 31st, 2025 arrived. No dramatic vote, no announcement. The enhanced credits simply expired. Congress had failed to renew them. And 22 million people woke up to a very different world. Let's talk about scale. 22 million people had enhanced subsidies last year. That's more than 90% of everyone who buys insurance on the ACA marketplace. 9 in 10 people on that platform. The Urban Institute projects that 5 million people will go completely uninsured in 2026 because of this. 5 million people who had coverage losing it, not because they couldn't manage money, but because the math stopped working. 7.3 million will leave the ACA marketplace altogether. Some will go uninsured. Some will downgrade to bare bones bronze plans with $15,000 deductibles. In California alone, bronze plan signups jumped from 23 to 29%. The economic damage goes beyond the individual families. The Commonwealth Fund found that nearly 340,000 jobs could disappear, 154,000 of them in healthcare itself. Hospitals losing patients lose staff. Texas alone could lose 83,000 jobs. Florida, 57,000. These aren't abstract numbers. They're the nurses, billing staff, and technicians who serve the people who just lost coverage. But wait, let me show you the part that should make you stop and think. Because the thing nobody's talking about is the cliff. The original ACA had a cliff at 400% of the federal poverty level. Earn $1 under that line, and you're fine. Earn $1 over, and you lose all your subsidies. Every penny. The enhanced credits eliminated that cliff. Now it's back. A 60-year-old in Wyoming earning $62,601, just $1 over 400% of the poverty line, now owes $22,452 more per year than someone making $62,599. And here's the other twist. The House of Representatives voted to fix this, 230 to 196. 17 Republicans crossed their own party line to support it. The bill passed, then it went to the Senate and died. So who exactly are the 22 million? KFF calls them the missing middle. They're not poor enough for Medicaid. They're not employed by a company with benefits. They fall in between, and they're the people taking the full hit right now. There's a couple CNBC interviewed. Joint income of $50,000. In 2025, their deductible was $0, and their prescription cost was $1,500. In 2026, same plan, their deductible became $15,000. She told CNBC, "If we have to go to the hospital or something, we'd be taking on debt for years." This isn't a wealthy person complaining. This is someone who did everything right and is now one emergency away from financial ruin. The youngest adults are hit hardest in relative terms. 19 to 34-year-olds face a 25% increase in uninsurance. Black Americans, 22% more uninsured. Hispanic Americans, 15%. The burden is not distributed evenly, ended. Not because it failed, but because it failed ended. Not because it failed, but because no one voted to keep it. Let's go state by state. Wyoming sees the largest dollar increase for older adults at the income cliff. $22,452 more per year for a 60-year-old just above the threshold. West Virginia, $22,000. Alaska, $19,600. Nebraska shows a 239% premium increase. Montana, 231%. Rural states, rural people. For older adults specifically, ages 50 to 64, this is devastating. The ACA allows insurers to charge them 3 times more than the youngest adults. Combined with the subsidy cliff, they get hit from both directions at once. In California, 29% of enrollees downgraded to bronze plans in 2026, up from 23% last year. Bronze plans are cheaper monthly, but come with massive deductibles. People are gambling on staying healthy. The healthcare job losses are concentrated in states with the most uninsured. Texas at 83,000 jobs, Florida at 57,000, California at 31,000. These are healthcare workers losing their jobs because their patients lost coverage. The total economic hit: $32.1 billion less in healthcare spending, $40.7 billion less in state economic activity. This isn't just a health story, it's a macroeconomic story. As of March 2026, a bipartisan group of senators is negotiating a potential 2-year extension, but it's not guaranteed. Millions of people are living without coverage right now, waiting on negotiations that have no deadline. A policy that worked, that covered 22 million people, that expired not because it failed, but because Congress chose to do nothing. The question is, what happens next? Follow for weekly policy breakdowns and tell me, should the Senate pass this extension?